Okay. Good morning, good morning, good morning. So, what we're going to be doing today is we're going to be going over the airway lecture. Okay. What we're going to be going over today is the airway lecture. The airway lecture is going to cover both the pathophysiology and the actual anatomy and physiology of the airway. Okay. It's going to be a lot of information. I would highly advise you to take notes and make sure that you're paying attention to it as we go. Okay. If you have any questions, please shout out. It's more important that you get the information than not. Okay. So the reason that this is so prevalent and this chapter is so long and there's so much information is airway is the basic principle behind everything. Okay. Not just airway, but maintaining the airway, maintaining the person breathing. Anytime that there's a disruption in breathing or there's a disruption in the movement of air, your patient is going to suffer in some way, shape, or form. Okay, we're going to talk about the three components of it. We're going to talk about of the breathing cycle. We're going to talk about oxygen reaching the tissues, or as I like to refer to it, the end user. We're going to talk about every aspect of this morning, okay, or today. And like I said, if you have questions, please stop me at any point in time. All right. So this is just an overview of the anatomy and physiology of the airway, both the upper and lower airway. As you can see there, the upper airway goes all the way down to the larynx. Well, the larynx is everything up to the vocal cords, okay? Everything up to the vocal cords. All right, and it's important to understand that that portion of the airway, while smaller, is actually just as important as the much larger lower airway. Okay, everything there, like I said, is what comprises that lower airway. Okay, or everything from there down, the larynx down, is what comprises that lower airway. So we're talking about the lungs, the actual carina, which is the split in the airway as it goes to the right in the main stem and into the lungs. Okay, and then we're going to talk about everything down to the level of the alveoli and how gas exchange takes place that causes breathing and waste to move out, oxygen to move in. Okay, so the main function of the upper airway is to warm, filter, and humidify air. Okay, inside the nose, it does something called turbulence, where we have something called turbinates, which causes turbulence, or like tornado type activity inside the nose. Okay, it causes tornado-like activity inside the nose. As this happens, it makes the air warmer, it makes the air moist, and allows the air to move and take off or throw off the excess bacteria and whatnot that is in that air. Okay, so inside that area you have the nose, the mouth, the pharynx, the larynx. Okay, these are all the components of that. Okay, and like I said, it is divided into two sections, and the first one we're going to talk about is what's called the pharynx. Okay, the pharynx itself, this is the tube. That's that picture there on top of page, what page is that?
389.
389. Okay. And this is the tube that runs. Yes.
Can you go back?
Back one? Yes, absolutely. Absolutely.
So with the like you're saying, the upper airway warms and filters and humidifies
Yes.
the air. Is this where the whole I've got to have a humidifier to sleep kind of comes from?
Yes. The humidifier to sleep. Well, not even just that. The thing with humidified air is the air we breathe in is humid anyway, just from its natural properties. So as that happens, what it does is there's moisture inside the mucous membranes inside the nose and the mouth. The turbinates are prominences inside the nose, and I'm going to show those to you in a minute. And as the air passes over them, it causes that tornado-like activity in two opposite directions. And as that transpires, it pulls the bacteria off and pulls the moisture on to the air as it goes in. Because the last thing you want to be breathing in is dry air. Okay? You breathe in dry air, it's going to irritate your airway. Okay? So, like I said, as it creates that tornado-like activity, it throws off bacteria, throws off dirt and things like that. Anything that's going to going to be rejected by our lower airway, and it attaches to something called cilia, C-I-L-I-A, which are the little hairs inside your nose, the irritating little things that hang out. Yeah. All those inside there, and they go all the way down through part of the upper airway. They're called cilia, and that's where the bacteria and the dust particles and things like that settle. So like when you sneeze, that's actually the reason you sneeze, is those are irritated and it tries to throw that bacteria and dust and all that stuff out. Okay? Yeah. See? A plethora of useless information. Okay. So everybody's good with that. All right. So inside the pharynx, this is a tube that runs from the nose and the mouth all the way to the esophagus and the trachea, where those two split. So you have the nasal pharynx, and you see those little pink prominences up there at the top? Those are actually your turbinates, okay? Those are the things that they run over. They look like tonsils in the back of the nose. And then you have the oropharynx, where you actually have the tonsils, and that's kind of what the tonsils do there also. And then you have the laryngopharynx, and the laryngopharynx is actually the epiglottis and the vocal cord itself, okay?
So where does the little tonsil stones be at? Is the oral? Or
The tonsil stones or the tonsils
The
themselves?
tonsil stones.
Tonsil stones are actually inside the tonsils.
Oh, but.
So all that is actually right in here, right in those prominences there. Okay. Okay. So, like I said, the nasopharynx filters out dust and small particles. Like I said, that is the whole purpose of it. It is the filter. It clears everything out. Okay, or attempts to. It warms and humidifies that air and allows the, like I said, the cilia that line that mucous membrane filter out the dust and the small particles. Okay. The oropharynx itself is the posterior inferior portion of the oral cavity. Okay. The epiglottis is that cutoff point. This helps prevent food from spilling into the actual airway. All right. The epiglottis closes, it's a little flap that as the throat begins to undulate or begins to move to try to move food and fluids down to the esophagus, if the epiglottis will close. Okay. And all that does is keep things from getting into the airway. Everybody good with that? Yes. All right. Also the larynx. Now, the larynx, like I said, is that lowest portion. It is, they say that it's a complex structure, and what it is, there's several different cartilage pieces that form this larynx. They're protective. This is what protects that junction with the trachea, where the trachea and the oropharynx, or what they call the laryngopharynx meet. Okay, and it has to be protected because, like I said, that's a very, very important part of, to include the epiglottis, part of the way that we breathe. This is the line of demarcation, as they say, where the upper airway ends and the lower airway begins. And this is kind of what it looks like here. Or not kind of, that is what it looks like there. Okay, so you have the hyoid bone. We talked about the hyoid bone before. This is the only bone in the body, you may want to write this down, that is not connected to another bone, okay, by tendon or ligament. All right. The only place, I'm gonna tell you honestly, I learned about this not in a medical textbook, but from Horatio Caine on CSI Miami. Okay, and it was a case where somebody was choked and that hyoid bone was broken because that's what actually snapped the trachea and caused them to succumb to their injuries. Okay, then you'll see here you have the thyrohyoid ligament. Excuse me, if I can get that right. This is the ligament that connects the hyoid bone to the laryngeal prominence or the thyroid cartilage. Okay, now this thyroid cartilage The thyroid cartilage is what protects both the thyroid and the upper portion of the trachea. Okay? This is that connective tissue. All right? This is the cricothyroid membrane. So if you ever see somebody where they talk about somebody getting trached or they puncture a hole to open the airway, this is where it happens. In between the thyroid cartilage and the cricoid cartilage. And you can actually feel it in your neck. There's just a little hole right here. Okay? Just a small, small hole. And that's where we're going to put it. So if you've seen the movie The Heat with Sandra Bullock, where she actually stabbed the guy in the throat in the restaurant with a big pin, that's where it happens. Okay? Right there in that cricothyroid membrane. So you're going to need to know that. Okay, then you have the cricoid cartilage. And what the cricoid cartilage is a large ring that is protective. Okay, this protects the cricoid, the very upper portion of the trachea. Okay, the very upper portion of the trachea. All right. Now, then you have the area known as the glottis. Now, wrong button. In the glottis, or what's called the glottic opening, there's a few important structures inside here, and we're going to talk about those in a second. Those are the vocal cords. All this is thin muscular tissue, and what that thin muscular tissue does is it vibrates to cause what's called phonation. This is what causes us to be able to make noise as we talk. Okay, so if there's damage to the vocal cords, that's why you cannot speak properly if there's any damage to the trachea or that area of the trachea, because of the fact that those vocal cords can become damaged. Okay, they can also become in what's referred to as pharyngitis or glottitis or epiglottitis. Those vocal cords can become inflamed and actually cause you to not be able to speak, cause you to drool a lot. It happens a lot in kids. Okay, but the whole purpose of the vocal cords is to cause phonation, which allows us to speak, and the epiglottis is the protection. Remember that. The epiglottis is the protective layer that covers, it's a flap that will cover the opening of the trachea to prevent entry of substances like water, vomit, food, anything that's not supposed to, anything other than air. Anything other than oxygen going in or carbon dioxide going out is protected by Okay. So they're protected by the epiglottis. That epiglottis will close and keep everything except for oxygen and carbon dioxide going out. Oxygen coming in, carbon dioxide going out. That's the only thing that's supposed to be moving. Okay? Alright. So, then we have our lower airway. So the lower airway is the pathway to the alveoli. Okay? And there's a word I'm going to talk about in a minute that's going to make a lot of sense here shortly, but that word is going to be surfactant. S-U-R-F-A-C-T-A-N-T, surfactant. Okay? The whole function of the lower airway is to deliver oxygen to the alveoli. That's the whole purpose. Okay? The lower airway is the trachea, the bronchi, and the lungs. Okay, and ultimately the alveoli. Alright, the alveoli are part of that lower airway. So the purpose of the trach, okay, and they're all going to be listed on the next page, if y'all agree with me switching. The purpose of the trach, this is the pathway down to the lungs. Okay? It divides at a point called the carina or carina. Okay? And just to show you, this is kind of what it looks like here. And how it works for kids. So you have your epiglottis here, okay? And then the glottic opening. This is your trachea. And as the trachea comes down, there's rings all the way down through it, right? You get to a certain point, and then this is what is referred to as the carina or carina, okay? and that goes down into the lungs. Okay? So, trachea, carina, bronchi. And you have a right and left main stem, okay? If ever you've seen the abbreviation for right or left, that's what it looks like. Okay? You have a right and a left main bronchi. The thing to know about the right and left main bronchi is the left bronchi deviates from the carina at 45 degrees, roughly. Okay? The right main is at 15 degrees, roughly. Okay, give or take a little bit. Why is that? Anybody?
This is the heart.
Exactly. Because the heart sits right here at what's called the mediastinum. Okay, remember that from A&P? Sits right there in the mediastinum or the middle of the chest. And because of that, that bronchi, the left lung, only has 2 lobes. So it has to deviate to the side over the top of where the heart would normally sit, or normally sits. Okay? All right. Okay. So the bronchi themselves are supported by cartilage. And what they mean by that is, as those bronchi deviate and go down, okay, they have, just like the rings that, the cartilaginous rings that go around the trachea, those same rings go around the main stem bronchi as they go down into the lungs, okay? And the whole point of those is to carry oxygen into those lungs, okay? It's no different than your water system. And if you think about your water system, as your water system comes from your water treatment plant to, or from your water treatment plant to your home, there's several different sizes of tubes that it has to pass through. Maybe a 4-foot main, 3-foot main, whatever, 6 or 8 foot, depending on where you are in the country. And as it passes through there, it goes into smaller, 24-inch or 12-inch mains, and then from there it goes into service lines. And as it goes into service line, how big is the service line that actually runs to your house? 1 inch, maybe 2 inch, depending on the size of the structure. Okay, so if you think about that, with your lungs, the exact same thing happens. Because remember, when we talked about the cardiovascular system, you have arteries, arterioles, right? What are arterioles? Small arteries. And that's all bronchi and then bronchioles, which you're going to hear that term, bronchioles, B-R-O-N-C-H-I-O-L-E-S, bronchioles, okay? Those are just smaller bronchi. And all those take the oxygen down to the level of the alveoli, okay? And that's where oxygen exchange or gas exchange takes place, okay? And this is a picture of that. So there you have the main bronchi coming in, you have the smaller bronchi, and then all the way down, see at the bottom? They get smaller, 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 they deviate down to bronchioles, no different than venules or arterioles, and then ultimately ends up at the alveoli. Okay? The alveoli are the terminal ends, and those run the entire length or the entire circumference of the lung. Okay? But that's the terminal end of where that oxygen goes. All right? Inside the lung. And the purpose of that is that's where gas exchange will take place. Okay? Is at the alveoli. I'm beating that dead horse because you're going to hear that a lot, and you're going to need to know that a lot. Okay? From there, like I said, the bronchioles are smooth muscle. Okay? They constrict and dilate as oxygen passes through them. So they're reactive. As air moves, they are reactive. Okay? The bronchioles get smaller and smaller until they get to the point of the alveoli. Now, the alveoli is where gas exchange takes place. This is where oxygen goes on to the hemoglobin in the red blood cells, and carbon dioxide comes off of the red blood cells to be transported out of the body. Okay? So that exhalation is where the carbon dioxide